We're going to take a moment now and let you experience a little bit about what a nutritional exam in our office looks like so you can have a little bit better understanding. We're going to flip the camera around to our testing office.
Cool.
And you'll get to see a little example of what it is we're going to do. Are you ready?
I'm excited.
Look at that. All right, well,
I'm doing this?
You're doing it.
Oh, okay. All right.
All right.
We'll see you on the other side.
Yes. So let's flip the camera around and take a few moments and we'll go through.
You can't make noises getting up.
Well, you know.
That's fine.
That's why we're getting tested. All right.
And we're not going to tell you, but we do have a live studio audience right here in the corner. They did not want to be on camera, so we won't mention any names. But yes, and so we're excited about that. We encourage people to come in and watch us live, not just on Facebook and our YouTube channel, but live, because this is when we just able to share more energy. So the victim, our patient would lay down, okay, and Amy so graciously volunteered for this, and we're going to run through a brief test about what we do. And so we get somebody on the table, right? And this is a puzzle. Every person, to me, is a puzzle, and that's how we look at it. We have the neurological system, the cardiovascular system, musculoskeletal, we have all the organs, we have the endocrine system, and go on and name all 13, but I won't. And so we need to know, how is this body working together? Because whether a person comes in with one symptom or 15 symptoms, it's one thing that we have to get to the cause of. What is the root cause? And the body is a lot like a little kid, okay? Everybody's body. And so your child comes over to you, or a child comes over to you, and for us it'd be like, hey, mom, 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 and you ignore the child. So what does the child do? They get louder, mom, mom, mom. And if you ignore the child, what happens? Next thing you know, they're knocking down the pots and pans and beating on the walls, and they're just trying to get your attention. Your body is the same way. It's trying to get your attention. So when you wake up with a little stiff back in the morning, your body's trying to get your attention about something. You say, oh, and we try and justify, oh, well, I overdid this, I overdid that. But why did you not recover during the night while you were sleeping? That's a good question. Over years and decades, by ignoring these little things, more and more symptoms will arise. The little kid banging the pots and pans. So when people come into our office, our issue is we need to figure out what is the primary cause, what's underlying in the body. So the first thing we always want to do is make sure the body is willing to communicate with us. So she's going to hold, we're going to use kinesiology. Amy's going to hold her hand nice and tight. She's going to push that way towards the wall. I'm going to push towards her feet. We're going to match pressure. The goal is for her not to throw me through the wall because that hurts my head. Hold nice and tight. Good. Okay, next I'm going to find her belly button and hold nice and tight. And it's strong. Can't move her arm with that. And I'm not overpowering her, I'm just matching her pressure. But I want to make sure she's in agreement with me. So I'm going to take the back of my hand, go over a heart meridian, hold nice and tight, strong, so she's open, willing to do this. Now I'm going to test right between her eyes, so to speak, the front and the back, the positive and negative part of my finger. So hold nice and tight, strong with positive, hold nice and tight, hold tight, weak with negative. That's actually good. We want to see changes. So now I'm going to go back over her belly button, hold nice and tight. This is a regulatory point. Hold tight. Good. Close your eyes. Hold nice and tight. Good. So her regulation is open. What does that mean? That means her nervous system is willing to talk to us, number one, and her body can switch from an active to a resting state. There's so many people we get just here and it's blocked, meaning your body can't switch from an active to a resting state. And I see heads nodding over in the corner. Yes, they're in agreement. Now I want to make sure her body knows that when she gets up, it's getting active, and when she lays down, it's going into rest. And so we're going to do this other technique. And we'll just put her thumb and pinky together, hold nice and tight, good and strong. Her eyes are open, stay open. Add another finger, close your eyes for me, good. Take this finger away, boom, good. You open that up. So her body says, yep, when I lay down, I'll rest, and when I get up, I'll be active. So that's good. I'm just going to bring this down a bit, get a little blood flow to her shoulder. Now I want to go through and see what's happening. So we're going to start and go through a bunch of points. Hold nice and tight. I want to first check out different points of the brain and the head. This is really intense. And I will tell you many times, we'll get some people in here and we'll start asking them about stroke and seizures and finding out. Good. So coming down through her head nice and strong. Little weakness here. So that's tonsil. She has a little immune thing going on. Good. Thyroid's nice and strong. I'm going to check some lungs, some heart, and check different immune points here. Now we're going to get into some digestion. There's spleen, stomach, gallbladder, liver. You can see how her arm's moving. Gonna look for pancreas, nice and strong, so it's not a sugar handling. Check her small and large intestine. Check some ovaries, uterus here. Gonna check heart, valves, bone, ligaments, muscles, and skin. And now we're gonna come back in here, hold nice and tight. Adrenal, good, good. Kidney, and of course bladder. And so let this relax now for a second. And so what are we finding? We're finding with her, she's got some tonsils, some immune issue going on, spleen, stomach, gallbladder, liver going on, and adrenal, stress handling gland. Okay, so that's 6 things. The question is, what is the primary? Because I can give nutrition to all 6 and we give her 100 things. No, that's not what we want to do. We want to strengthen the primary. And whatever the primary is, we want to get that layer of the onion off. And as we go through care, keep seeing what starts to unfold. As something heals, it opens up, and maybe something else might show up, or maybe healing is done. So we're going to look for a primary. Good. So out of those 6 things, it's not spleen, stomach, gallbladder, or liver. I'm going to check her tonsils. Not her tonsils, so it's not immune. Hold nice and tight. Let this relax. So it's her adrenals, her stress handling glands. Do you have any stress in your life? No. So anyway, yes. So now we're going to do some stress tests. Okay, we want to see what's happening. We're going to check her with some chemicals. We're going to check her with different heavy metals. So we'll start with the chemicals first. So we're going to hold nice and tight, get on that adrenal reflex point. They're just Chinese acupuncture points. No change. So we know that. Now we're going to check her on some heavy metals. Hold nice and tight. She has a change there. Okay, so I'm going to take out one that I think it might be. There's some that are usually more common than others. Hold tight. Weakens. Good. I'm going to put this back on. Hold nice and tight. Strengthens. So we know what now, as far as heavy metals, what it might be. And so we have a couple supplements to check. And good. So we're going to try this one first. Hold nice and tight. And so what's happening? Her body is reading what's in there, the energy that's in the bottle. And some people will say, oh, well, your body can't read energy through glass. Glass doesn't transfer energy. Not true. Anybody out there have houseplants? So how do your houseplants grow? Well, you water them. Okay, good. Throw them in the closet and water them. What'll happen? They're going to die. They need sunlight. Do you take them outside in the sun 365 days a year? No. What's happening? The sunshine is shining through the windows, and the energy of the sun is coming through the glass and hitting the plant and allowing that plant to grow, providing you're watering it regularly. Good. So we'll just reset this for a second. Hold nice and tight. Ready? Resist. Still strong. So our body says, nope, that's not it. So those are the first 2 things. Now we're going to continue to check, because the question is, where's this aluminum hiding in her body? Hold nice and tight. There it is. Good. So when I touch over her stress point, the adrenals, that straightens out, and I want to double check, so I'll take my hand off, so instead of weak, it should now be strong. And it is, nice and strong. So we know she's got an issue today with aluminum. And why do I say today? Because as we take care of it nutritionally, and it clears out, that should go away. Might take a couple weeks, might take a couple months, depending on how intense that is. So I'm going to check her now on immune stressors. We're going to look at parasites, fungus, bacteria, and viruses. Hold nice and tight. Okay, so there's something there. Now I'm going to go make this go a little quicker. She's going to put her hand over those 2. Hold nice and tight. Not there. And we're going to put it right here. Hold nice and tight for me. Good. Something there because it stayed strong. Oh, light comes on. It's beautiful. Hold nice and tight for me. Resist. That one's okay. Up nice and high, just like this. Hold nice and tight. Stay strong. So it's a bacteria. Keep your hand right there for me. And so we want to support her body with something that's going to improve her immune system, strengthen her immune system, and be able to fight bacteria. Hold nice and tight for me. And is it a full rage bacteria that's going to make her ill and sick and knock her out? Maybe. Or maybe it's something that goes under the radar, but it's inside her organs, and it's just disrupting enough of her body function so she can never get back to full health. Okay, so try to test one more right here. Hold nice and tight for me. No. I want to go back. So it's this right here. It's a supplement we have called Congoplex, which is designed for bacteria. Hold nice and tight. Good. And when I take my hand off, hold tight. Strong like bull. Good. We'll take that down. And now we're going to check her on food. So we're looking for different foods that may be stressing her body. Is it grains? Is it sweeteners? Is it dairy? Those are the top ones that we check for. Hold nice and tight. Hold tight. No, nothing there. Okay, because remember we had that weakness. So we're going to put these back on her body because we know these clear out the stressors that she has. Hold nice and tight for me. Good. Hold tight. Nice and strong. And now I want to support her adrenal glands. Her adrenal glands are the primary part of her body right now that needs support. So we're going to check a few things just for adrenals, okay? And I want things to stay nice and strong. Hold tight. Weakness. So it's weak. The energy in this bottle is not matching her energy. Her body says, no, I don't like that. We'll check this one. Hold nice and tight. That's a maybe. Check this one. Hold tight. No, not really. Hold tight. So her body likes that one. One more to check for adrenals. Hold nice and tight. Doesn't like that. Likes that one. So that's adrenal support. Now there's some other things we always want to check. Most importantly, one of the pillars of health is digestion. And we always want to make sure that you can digest your food better, because if we give you whole food supplements and you can't digest them, what's the point? And so I want to see, how does she need help with digestion? Not there. Hold nice and tight. Not there. So that's good. And she may not need the help, and that's okay. Check this one. I know this is one of her favorites. Digest. Good, nice and strong there. I can go back to her adrenals. It should change. It does. Bam, nice and strong. So that's perfect. Okay, now, another thing that we find, everybody, just about, almost everybody, is deficient in essential fats. So we want to find an essential fat that would be right for her body. We have 17 that we use. I don't want her on all 17 some days, but no. So I'm going to pick a few and check. Ones that are there's some that are more common. Body likes that one. Ooh, likes that one. Does it like this one better? No. You ever walk into a store and you look and you say, ooh, and then when you look over there, you forget about the first object because the second one is shinier, and then you turn your head and you see something that's the shiniest and you forget about the first two? Body does the same thing with nutrition. If we show it something, hold tight, it'll tell us which one it likes better. And sometimes it might like something, and when you show it something else, it says, oh wait, I like that one better. Hold nice and tight. Good, hold tight again. Bingo, right there. And so here we have a little protocol together, 5 different supplements to help her body function better. Now, here's the kicker. Let's go back and check her tonsils. Hold tight. Nice and strong, so the immune is supported. Spleen, stomach, gallbladder, liver, all supported. Hold nice and tight. Adrenal supported. So we know this program right here will help support her body and help it function. Then comes the fun part. Okay, so the question is, how many of these does she need? So I'm going to take her hand, make a little tray just like that, and we're going to start off with one of the supplements, and I'm going to put 4 in her hand just like that. Hold nice and tight for me. Weak. I'm going to take 1 out. Hold tight. Strong. So this tells me specifically her body needs 3 of these supplements. Okay? I'm not guessing at it. I'm just seeing what she needs. This is for stress. Hold nice and tight. She needs the whole bottle. No, hold tight. Good. Hold tight again. Right there. So here's the supplement. Her body needs 6 of these. So we have 3 on the first, 6 on the second. And notice they're all on her body so that we can check. This one's a wafer. It's not going to come out, so we're going to do what we call pulse it. Start with 2, 3, hold tight, 4. She likes 4 of those. So remember, we have 3, 6, 4. Check this one right here. Yep, sometimes as it gets through the summer, the pearls tend to stick together. Too much, too much. Perfect. So 3, 6, 4, 3. And we have 1 more to check. Good. Hold nice and tight for me. Good. Hold tight again. No, still a little weakness. That one's strong. Good. So it's 3, 4, 6, 3, and 3 on this supplements. Okay. So now we've checked them. We know what supplements that she needs. I'm going to place them right here. And here's the kicker. I'm going to have you sit up and face me, please. Good. So most nutrition checking, response testing will stop there. We take it a little further. Okay. Arm, she's going to push up. I don't want her to walk out with one Arnold arm. Good, both of them. Just kidding. Hold tight. So she's going to push up. 1 more time. Good. I'm going to put my hand. I'm going to check her for sleep. For falling asleep. She doesn't fall asleep. I'm going to check her for staying asleep. Yeah, she doesn't wake up. And I can tell you, she doesn't wake up. But I know it takes her a long time to fall asleep. So the sleep point is weakened. So I'm going to put a supplement in her hand. Hold nice and tight. Still weak. So that's not the one. I'm going to put another one in her hand. Hold nice and tight. Strong. So I know that this supplement that we checked her on, one of the 5 we have, will help improve her falling to sleep. Okay, will be perfect. It's not a drug. It's not going to push the nervous system, but over time it's going to help her body heal so that she falls asleep quicker and quicker. We're going to check some digestion, so she's going to make a claw, put it around her belly button. Perfect, hold nice and tight. And we see there's a weakness there. So we're going to check on some supplements for that. We're going to try this one right here, hold nice and tight. Not going to make a change. Not that it doesn't help her, but for that specific issue. This one right here, hold nice and tight, strong like a bull. And so that's the supplement that's going to really help make her digestive tract strong. So if she came in with a list of 3 symptoms or 12 symptoms, I would want to go back through and check each concern that she had and make sure the protocol that we have fits what her body needs. Awesome. Would you like to say anything else in closing, or turn around?
We can turn back around.
Oh, we're going to turn back around?
We can, or
Okay.
I guess we can sit here and finish if you'd like.
I'll film you. Oh, go ahead, still going.
Oh, all right. Well, that in a nutshell is basically what we do here in our office with nutrition response testing. And this month, if you'd like to come in and get a consultation, we do a consultation at our expense. So you're welcome to come in and just talk with us to see if and how we can help you. But for the month of July, we are also offering a special. It's $75 to come in to get a full nutrition check, and that also includes your report of findings. It's regularly $300, but till the end of the month, you can come in for $75, get the full check, the report of findings, find out the nutrition that you need specifically for you, and we help you with a food protocol as well that's going to help you with the right foods that your body needs to help heal itself and get well.
And I always say, if you have health concerns that aren't getting better, if you've seen other doctors but the results you're trying to obtain aren't being achieved, and if your health is really starting to affect your life, home and or work, then come in and get checked, and let's see if we can help you and what we find.
And that's it for today. That's nutrition response testing in a nutshell. And we're really glad that you joined us today. We hope you have a fabulous day, and we hope to talk to you later this week.
Awesome. Have a great day. Thanks. I'm Dr. Dave.
And I'm Amy.
And we want to be your inspiration
For healthy living.
Have a great day.
Bye, guys.